Ladies and gentlemen, it gives me the greatest pleasure to be here, and I thank Dr. Narahari and all his colleagues for the great privilege of being here and being able to share with you in this very important event. I met Dr. Narahari a number of years ago when I was at an international conference, and he was presenting his very early results in Brazil. And it was at that time that I realized that he had something very special occurring here in Kasaragod. And so therefore, it is my privilege to support him in any way that I can and to encourage him to pursue this work, which I believe is going to be of great benefit to many patients and will also be a benefit to us professionally in improving the care that can be provided. I would like to share with you in this time the work of the International Lymphedema Framework project, because I believe it will be helpful for you to understand this work and the way in which we hope that in partnership with Dr. Narahari, we can enhance the work that he is doing here in India. The Lymphedema Framework project has an ambitious, a scary, a difficult aim. But that aim, although it is very large, is something that we dream, we have a vision to achieve. And that is to support the development of lymphedema services, delivering the best practice that is possible. This is using both biomedical and traditional approaches to care in all countries of the world. What are we hoping to achieve, and how are we hoping to achieve it? We believe that every country is unique in the problems that it faces, and yet there are also many common problems that patients with lymphedema across the world face. And so our long-term goals are to help countries to develop models of care that are effective in the most effective way at delivering care to the most number of patients. We believe very much that this requires an international infrastructure of support, and that is vital. In many countries of the world, not just in India, in many other places, including Western Europe, lymphedema is not recognized as a healthcare problem, it is not paid for, and even in the UK, 5 years ago when we researched this area, 60% of the patients we found were not having any treatment for their lymphedema. So it is a global challenge that we are facing. And we believe that it is a global response that should be raised. And by raising awareness, by working together, we will help to achieve this. Partnerships, we believe, are the very central part of effectiveness. And our international collaboration already has begun that work. We are partnering already with national organizations, with the international global organizations such as the World Health Organization and GELF, the Global Association for the Elimination of Lymphatic Filariasis. And you must remember that whilst for you here in India, the problem you face is very much related to filariasis, in many parts of the world, this is not the case, and the patients we see have lymphedema due to other causes. Yet nevertheless, there is huge mortality and huge morbidity. We also recognize that there are the very important work to be done with the allied health professionals. And so groups such as the International Skincare Nursing Group are vital in our quest to improve lymphedema care. It is interesting to come to a country like India and see the wonderful work that is being done with patients. And we too have the same ethos, the same belief about patients. Because in our work, in our research partnership, our patients are equal partners. The patients have undertaken research with us on the experience of being a patient. They have a research portfolio on self-management and understanding self-management. And they are integral in all of the production of our documents, in the production of our guidelines, and in all of the work, including our conferences. So we share with the same passion the importance that patients play in improving care for them. We also must look for funding, and another source of funding that we very much are using in the West is that of industry. The industry who make medicines, who make bandages, who make garments, need to play a part in helping to fund this very important problem. And I know that in India you will have other funding streams that you look to. And I do encourage Dr. Narahari and his team with us to seek funding wherever it may be found in order to improve your work. Why do we need an International Lymphedema Framework? Why did we set this project up? Well, as I've said already, lymphedema is a low health priority. It is not considered important in most countries of the world, despite the fact that we know there is so much suffering and there are so many patients suffering with the condition. Many countries of the world, in fact, I would say the majority of countries of the world, have very limited good care. So there is a massive challenge here. There is a lack of awareness of how many patients suffer with this condition. In my country, in the UK, 5 years ago, we had no appreciation really of the size of the problem. There was a belief that lymphedema patients had all had cancer as the cause of their lymphedema. And it was only when we set out to do a large epidemiology study that we found that that picture was not true. That 50%, half of the patients, did have lymphedema secondary to cancer, but that the other half of patients had primary forms of lymphedema due to an abnormality in their lymphatic circulation, or they had other forms of lymphedema. And what we saw very clearly was that as people got older, so the problem became worse. So it's a very large problem. And the research basis for many of the things that we are trying to do is very poor. And we must strive to try and produce good quality evidence of what is going to work for patients. And that is a challenge to us, to actually provide that evidence. But it is a wonderful opportunity for an international collaboration, and I am delighted to be here to further that. I think it is important for me to describe to you the ethos about our work. We believe lymphedema can affect any one of us. It affects children and babies. It can affect us until the moment we die. We cannot guarantee that we will not be a lymphedema sufferer at all. So some of the things that are driving the lymphedema framework are in this slide. We believe that we must fight to make change. We must challenge the status quo. It is not acceptable to have people suffering in the way they are, and we must fight that. We must come together and be like-minded in our approach, and conferences such as this are a wonderful way of doing this. We also believe that we have much to learn together. The West and the East must learn together. We must put a marriage together of traditional and biomedicine, and we must learn from each other and be open to learning and to translate that learning into other countries. We must enable patients. Patients have a chronic condition, but they can manage their conditions so well if they are trained properly, and they become the very best treaters, better than anything that we can professionally do. So we must drive change. We must also empower professionals to believe that they too can make a difference. It is like a drop of water arriving in a puddle, in a rain puddle, and the ripples go outwards with everything that we try to do, and every one of us can play a part. Because at the end of the day, it is us who can make a difference to the patients that we have responsibility for. Now, the work of the framework is depicted in this slide. Our goal is development of services. But we have a number of other arms of the project. We will hold an international conference every year in a different partner country. We will set up an educational framework in order to be able to train allied health professionals, to be able to support the training of doctors and nurses. We hope to have money for PhD fellowships, for instance, to support the development. And we hope that there will be much product innovation. I would love to be able to see in India patients being able to have a bandage that lasts for so long, that does not need replacing, and that they can make locally. This is a dream that Dr. Narahari and I have talked about, and we want to bring into operation. We also have other research that must be in support of the work, and we have a journal as well. Now, to support the global work, we need a number of things. We have a vision for a global minimum data set. What does this mean? It means that globally we will have an appreciation of the size, the complexity of lymphedema, but most importantly, the outcomes of treatment when it is being delivered, so that we can begin to develop standards of care for each country that we can aim, that we can work to actually achieve, which will lead us to having an international data set, so that each country has its own data, but is also contributing to a true international data set, helping to raise and challenge governments and organizations to respond. We are busy working on this project at the moment. It is a very ambitious project. We need to get consensus on the types of data that we can capture. We've already developed the electronic database system, which we are very lucky because we have been given the support of the National Institute of Health, who have supported the data system we are working with. But our dream is that countries can begin to understand the size of their problem and the impact that they are having with their patients. I mentioned already that we want to have shared international conferences. We are already here today at the first partnership conference that we have ever run. So we are very, very happy and very honoured to share with you in this conference. We must take no credit, however, this is all the work of Dr. Narahari and his team. But we will also hold conferences. We are holding our first big conference next year. We have invited Dr. Narahari to join us. We've also had Professor Terence Ryan, who is joining us and will be awarded at that conference a Lifetime Achievement Award for all of his work in the field of lymphedema. It will be a chance for us to come together. It will be an opportunity for us to establish an exhibition of all the resources that exist in the world and to place those within something we have called the global village. So Dr. Narahari, bring everything so that you can showcase what you have here in India. And all of our countries will be participating, but the whole belief behind the conference is pushing forward the boundaries and pushing forward development of care. That is our dream, our vision. During that time of conference, we will have an international advisory board drawn around the world. As I've said, we have eminent guests here who are on that. We will have a patient conference that runs alongside of our main conference, and our patients will also participate within the main conference. And this is very exciting for us to be running this. And we want to see videos of the work, particularly in developing countries. so that people in the West are made aware of some of the challenges that you face here in India and can really see and learn from the approaches that you have taken. And we will have an award program enabling people to come to other countries on travel, scholarships, on research grants, and also rewarding excellence in different parts of the world. So we hope these will be successful events that really promote the change that we are wanting. A couple of years ago, we launched the Journal of Lymphedema. A couple of years ago, we launched the Journal of Lymphedema, which is the voice piece for the Lymphedema Framework project. And I am very, very delighted to say that we are publishing the proceedings from this conference as a supplement to be published this year, and we will offer that to you, Dr. Narahari, in succeeding years, if you so wish, so that this is introduced to the international community. We have other documents, again, that we want to make free to the world. This was our best practice document for lymphedema. And another piece of news for you is that we have secured the support from a publishing house to develop a best practice document for developing countries. And I hope this will again be something that you will find valuable. And we will be asking you again to lead very much on this, Dr. Narahari. And in the future, we have a real desire for children. There are a small but nevertheless important group of children across the world who suffer with lymphedema. And they really need to be given the very specialist management that is required to help them to grow and develop and fulfill their place in society. Another document that we have done and published is on compression hosiery. And these are all examples of the kinds of resource that is free to you to use and is downloadable and publishable and available to the countries that we are working with. It is interesting to see how every country struggles with the challenge of how to develop effective services. And last year we developed a document to try and help with how to put forward a case to develop a service. And there is much in this document that is equally applicable for you to use here in India as it is for us to use the document in Western parts of the world. And we will continue to try and develop documents that are helpful. And we will be guided very, very much by yourselves about what will be helpful in the future for you in India to guide the practice here that you're trying to establish. Another example of a document that we have done on bandaging. And again, another vision for our work is that language is not a barrier. And we wish to develop all of our documents into the main languages. We wish to hold the copyright so that it can be translated as well into local languages. And that is very important to us, that language does not become a barrier for people receiving knowledge and information. As I've said, there is much research to be undertaken, and these are just some of the international research areas that we are working on at the moment. We need to understand much more about treatments. We need to understand how compression bandaging works, how drug therapies work, how infection can be controlled. All of these are very important research issues. But we also have here a very important emphasis on understanding the impact to patients. What is it like to live with lymphedema? What is the impact of effective treatment on quality of life? I believe it is very great, the improvement with effective treatment. What about obesity? You see a picture here of a patient we have in the West. Obesity is a huge problem for us. And all of these are the kinds of areas and more that will need to be addressed in the coming years. We will have a website, and a website will be, again, a means of communication. The journal, we have a belief that one day the journal will be free to everybody. At the moment, we will make it free to everybody who wishes it here in India. And we wish it eventually to be a free resource around the world. All of our documents will be downloadable and printable. And we're going to have a glossary, a picture gallery, a skills and videos so that people can go to the website and gain valuable information. It will also be the source of our global data set, so that again this is where the information on the impact of lymphedema globally will be fully portrayed. And we're hoping to have a global e-newsletter for professionals. I believe Dr. Narahari particularly wants an e-newsletter and a paper-based newsletter for patients, and we are committed to doing that. And again, we hope this will be a useful resource to link to all of the international sites and their activity worldwide. As I've said to you, our belief in patients is mirrored in what you are doing here. We believe very much that patients and patient support groups are so important. In each country that we go to, one of the things that we require a country to consider is how they will involve patients. Not just professionals, not just academics, but how they will support patients to develop organizations that support the patient population. And in support of this, we have patient conferences. These will run every year, as well as being locally occurring in different regions of countries. There will be patient literature, and there will also be a whole program of research driven by the patients and supported by us as academics. And we're already seeing our patients publishing their own research in the journal, and that is very encouraging to us. I hope you appreciate already that we have a heart for what you are trying to do here. And the framework wants to support your work and that of other countries. And we have another number of things that we want to do in addition to physically being present and supporting you. We want to try and help support the development of low-cost, locally available treatments, and to make them respectable, understood, and used in the biomedical world, which is often very skeptical of such things. Because we believe that there is an evidence base that can be created from both biomedical and traditional medicine. And it is essential that patients can afford the treatments, and that the treatments that are so often developed in the West are not denied to the many countries of the world where this is not possible. And my mentor, Professor Ryan, I have learnt much of this from him, and I hope he feels I'm being true to the issues that he has taught me over the last few years. So, what will we do? Well, each country will have an international project director. Each country will have a framework to work with, and Dr. Narahari is our lead here in India, to work through what partnerships need to exist, and to work through the research that will be undertaken and the development within each country. You have already in this place a most wonderful approach to best practice, and we will be seeking to make sure that best practice is delivered in each of the countries we work with. And every country will be involved in an evaluation, and I'm delighted that Dr. Narahari is going to be undertaking some work even in the next year that is evaluating the quality of life outcomes of the approach that he has. And it is this work that will begin to show more and more the value on every level of what is being achieved here. So each country has to work In many countries in the West, it is working with industry, working with people who are committed, clinicians and academics who are willing to put real effort into making this happen and to work in partnership with us. And every country will be supported by the framework through an International Lymphedema Framework project director. And at the heart of this is ensuring that we are able to work together. In many countries of the world, we have to actually begin to describe the problem, to begin to establish how many patients there are and what level of unmet need exists. Because in many countries of the world, including places like the United States of America, they have no knowledge of the true extent of the problem. And then every country will need to develop a strategy that fits their country, and we will be there to support them in that, and to evaluate the effect of the efforts that they make in improving care by measuring this through the use of the global minimum data set. So, in conclusion, Dr. Narahari, honoured colleagues, I wish you every success. I offer you whatever support we can offer. Our resources are not infinite, but we offer you our very best. We offer you our hearts and our commitment and whatever resource we can give you.